Now, a lot of stories regarding your department and your activities overnight, and the first one has to be about NPHET modelling, that they provided advice to the government based on modelling data that was not taking into account the latest information on vaccination.
Yeah, that's right, which I was quite surprised to see that there were anonymous sources at Cabinet who were expressing surprise at this. It was very clear that the modelling was being completed right up to Monday, and that the NIAC advice came in on Monday, so it wouldn't have been possible for NPHET to incorporate that advice. Myself and the HSE are currently working through the implications of that advice, and of course it will be updated. But there's other things that it'll be updated with as well, as more information comes in. So, for example, as you'll be aware, Scotland yesterday reported their highest daily cases because of this Delta variant since the pandemic began. There's a question which the entire scientific community are watching the UK for, which is, how does that translate into hospitalizations, and how does it translate into death? So with the NIAC advice, with more information coming in from the UK, as we learn more, the models are regularly updated, and that will of course be the case with the NIAC advice as well.
It just seems ridiculous that NIAC provided advice on Monday and then NPHET didn't get in touch with you. I mean, you share a corridor, I believe, with Tony Holohan. So, I mean, didn't say, hang on a second, that advice we gave you, we just have to rerun the model and we'll get to you with more up-to-date information before you go to Cabinet. They didn't do that.
Well, they couldn't do that. NIAC provided the advice to the Chief Medical Officer on Monday. Professor Nolan was having to do the modelling over the weekend. We asked NPHET to present to us several days early because the hospitality sector had very reasonably said, please don't wait till Thursday. It's not enough time. So if there is bad news, and there was a growing fear because of Delta that there could be bad news, they said, please give us this information as early in the week as possible. So that's what we did. Mm-hmm. But Pat, it has to be said that NIAC and Professor Nolan's group, they're doing modelling all the time, and that modelling is constantly being updated as more and more information comes in, and this is no different.
Professor Luke O'Neill was on with us earlier, and he said if one of his students came in and offered him two scenarios, one which said there'll be 200 and something deaths, and then the other scenario is there could be 2,000 deaths, his answer would be, as a scientist, which is it? Come on, you can't be throwing such a disparity of figures around and expect anyone to take you seriously.
I have nothing but respect for Luke O'Neill. I think he has been one of the voices of sanity and reason and hope right from the start, and I thoroughly enjoy listening to the conversations that you and he have. But what Professor O'Neill will be aware is that the Delta variant being so new, there are still very wide confidence intervals around exactly the impact of Delta. In fact, there's still a conversation going on about just how much more contagious Alpha, or what we called the UK variant, how much more contagious that was than the previous strains. So it's not that NPHET is trying to be unhelpful. It's that NPHET is saying there is a wide range of possible outcomes from this, and we have to give them to you.
We had a total of 270,000 confirmed cases in 16 months. That's people we know were diagnosed with COVID. There may be many more who are asymptomatic and never diagnosed. So 270,000 cases in 16 months. We're expected to believe that there could be 682,000 cases in 3 months. You know, more than double Ireland's total case count in 16 months would suddenly materialise in 3 months. I just find that hard to believe.
Well, we all hope it doesn't happen. And what NPHET did was they provided 4 scenarios, and the scenario you're referring to is the worst case scenario. However, what we have learned since we got that information on Monday from NPHET is that Scotland yesterday, because of Delta, reported their highest case rates since the pandemic began. And think about this. The Scottish population is largely vaccinated, so they should be seeing a collapse in cases. What they've just reported is the highest case rates since the pandemic began. The UK, as a country or set of regions has now got more cases being reported than the entire European Union, again being driven by the Delta variant. So we can all hope for the best, Pat, but we have to plan for the worst.